Good morning, everyone. Welcome to this episode of Beyond Max Q. I'm your host, Mollie Jahner, and I am joined today by Cristina. We've been trying to film this for quite a while, busy schedules and vacations in summer, and so it is such a pleasure to have you here. She is an angel investor, and honestly, your career is the list is so long. I'm not going to do it justice. I would love for you to introduce yourself a bit and tell us a little bit about what you're working on, how you got there, and your journey.
Thank you so much, Molly. I'm really glad we finally made it because I know we've been trying
Me
to do
too.
this for a while. I trained as a scientist. I'm originally from Panama and I came to the US to go to college and, train as a scientist. When I was growing up in Panama, I never dreamt that that was going to be my journey. But, by serendipity, I ended up doing that. I spent 10 years in academia. I spent a little bit of time in Charlie Rice's lab at the Rockefeller University in New York. And from there, I went on to the NIH. Since I left academia and moved to the Bay Area, I've been doing primarily strategic partnerships and business development in biotech startups. The common thread between my academic career and my industry career has been cell and gene therapies. So when I was in the lab, I was playing a lot with viral vectors, introducing payloads, looking at immunogenicity, optimization of protein expression, and so on and so forth. And when I was working in industry, as a business development manager or alliance manager, I was working for companies that were advancing either gene therapies or cell therapies. And I think as most of us that have worked in that space, you just become very passionate because you see, these incredible outcomes that you don't see with many other modalities, right? And you get to meet the patients and you get to meet the families and you get to meet the investigators and really, get close into this field of once and done cures. So, that really energized me. I loved it. And with that also came a deep understanding of the challenges that the field is facing. And I think primarily is that of how complex and how expensive these therapies are. And that makes it very difficult to reach many geographies. So in many cases, patients have to travel, like to uproot their lives, to travel to be near a center of excellence, to get treatment. And, if you're fortunate enough to convince your insurance to pay the price tag, you're okay, but sometimes that's not possible. Or if it takes too long for you to get there, then it might be too late for you to get treatment. So to me, the field, could benefit from simpler and cheaper therapies. And, the way to think about it is sort of how computers were in the 50s. Well, they work, but they were very large and you needed an entire room to keep them. And they were very expensive and only a few people had access. And it was through engineering solutions that we're now able to put computers in our pockets. So that's how I view the field of cell and gene therapies. And that is why I decided to start investing in them. So earlier this year, kind of came up with this investment thesis for enabling technology platforms that are going to make this therapies cheaper and simpler so that we can reach more people, reach more geographies. And yeah, that's what we've been doing. Very excited because we closed two investments just last week and now looking
Congratulations.
into making a third one. And yeah, I'm very passionate to talk about this topic.
I love this. Well, and I think what I love the most is that you have been there and you have lived it and now you're investing in it, which I think is rare actually for VCs or funds or people who are investing their dollars. I think very often you talk to a VC, at least in my experience, and they haven't necessarily run a business that they're looking to invest in, and so it's very hard to have that partnership conversation. And so for you to, hey, I'm a scientist, I've been there and I've worked these things, I've been in the lab, I understand what you're going through, is so unique and special, I think. So I would love for you to
Yeah.
talk a little bit about what that looks like. When you talk to other founders or when you think about investing.
Yeah, thank you so much. I think one of the wonderful things about investing with this lens is that because I've been in the field now for 2 decades, you can really see how the field is shifting. Like we all know that for many of these products, the biology is the risk in a way. And we sort of know what we need to focus on. So you meet a lot of people that are like, oh yeah, that's a problem, and they're trying to work on that problem. So we have a clear idea of where the opportunities are. I think when you're coming at it from an outsider's lens, you don't necessarily see that, and you might get starstruck when you see like a deck with like a Nobel Prize laureate or a really cool technology. You might just want to invest in it, and that it's not that it might not be interesting science. I'm sure it's interesting science, especially from a good lab, but it might not necessarily be where the field is moving, right? So I think, the way I'm thinking about it and some of the people in this sector is like, what are the kind of problems that we need to solve and who is in the best position to solve them? And, this is something that actually occurred to me when I was on the other side, when I was fundraising for companies. I would talk to investors, and like you said, Molly, I was kind of surprised that they didn't really understand what we were doing, and I found myself saying, okay, we think this is very promising, but I just want to make sure that it is clear that it's very risky, that the science is still very early, and we need to do all these things to validate. I think having an understanding of that gives me an advantage because now I can evaluate projects with that lens and like know exactly what I'm getting into, on the stage I'm getting into. And I think that gives me an edge, to pick the right projects to invest in.
Well, because you've been on both sides, I would love to get your perspective on if you're a founder and you're looking for investment, where do you start?
So if I'm a founder and I'm looking for investments, I want to meet investors that see the world the same way that I do. So I would say don't waste your time go pitching to people that are not investing in your field or not interested in your field. I would say at the beginning, do a little bit more listening than talking, and just ask the investor like what is your investment thesis? What kind of founders do you invest in? And just kind of try to do a human to human connection first rather than a transactional, exercise. And that way, even if the investor may not be investing in your own sort of field, but you have already established that connection that they might be even more willing to help you. Like one thing that I love doing in this journey is like introducing founders to other investors. So sometimes I
Yes.
really like their projects and it's very clear that they don't fit my investment thesis and I need to stay focused and disciplined. But I want to like introduce them to other investors that I know are actively deploying in their space. But, in order for me to kind of get to that point where like, wow, that sounds really cool, I want to help you. At that point, I already kind of had a conversation with the person, and there's already an energy exchange, right? So the conversation has moved from just an interaction, a transactional interaction, to like more of a connection.
I love that. I love what you said about the energy exchange because I think that that's so real. You talk about, because this isn't just a check, especially when we think about medtech, biotech, like you're with this person for a long time. This is a partnership that could take 10 plus years to really come to fruition. And so it's you really need to kind of like them.
Yeah,
Be
I
able to
think
work with
so.
them.
I think, yeah, I mean, I think in the era of agents and robots, human to human wins always.
Yes.
So go for
Yes.
that first.
I love it. Well said. Well, and so I know that you are, you're an investor and you're working on kind of creating your own fund. Can you talk a little bit about that? What has that been like?
So, so that's, yeah, I mean, that's something that I'm working with a partner. I can't really talk too much about that, but we'd
Okay.
love to like dip in our commitments to the angel investments that we're making. And I think that's where the fund will play a role. So we're
Hmm.
very excited because we had very good reception and like people are, kind of see the problem, like especially people that are in our industry and understand the industry and also understand how powerful these technologies are. Like they've heard about CAR Ts, they've heard about precision medicine and CRISPR, or they've heard about
Yes.
stem cells and they just want to know more and they want to know
Right.
what they can do to advance to sort of match profit with purpose, which is what we're trying to do with
I
our
love that.
thesis.
Profit with purpose. That's really good. That's very well said. I'm a marketing person, so I love the one-liners, and that one's really good. Profit with purpose. I would love, since again, I know you can't talk about the fund, so I want to talk about the industry. Where do you feel like the next 5 years and then 10 years, what does that look like for your industry and the tech that's coming out?
Okay, yeah, that's a great question. I love to talk about the industry. So there's basically three things that I think we should be focusing on. The first one is automation, and that includes sort of robotics, computer vision, AI, and sort of moving away from manual processes. So in cell therapy, historically, this has been very artisanal in nature. You need a skilled operators, you need all this equipment, and it's not integrated. So typically, it's done in a centralized facility, and it takes, X number of days to get there. I think we need to move to a point where we can do this in a 1 day or less, and we can do it at the bedside or at least, very close to where the patient is. So that's the first thing I see. The second thing I see is moving actually away from autologous medicines to off-the-shelf medicines. So, well, it doesn't necessarily need to be moving from autologous, but really moving from something that can treat one patient to tools that can treat many, many more patients, right? So that's going to allow us to reach more geographies to increase in access. To me, the future of cell and gene therapies is in vivo genetic engineering. So completely bypass manufacturing cell therapies outside of the bodies to manufacturing inside of the bodies. And actually, just in the last, I don't know, since the year started, we don't see much IPO action in the biotech industry, but we've seen so much activity around acquisitions of companies that are developing this off the shelf technologies or in vivo technologies, very, very early stage companies, 4 or 5 years since inception, they're of high interest to big pharma. So that's super exciting to see because at the end of the day, those technologies are going to empower these drug developers to reach more patients.
I like that. And then do you think that, I mean, do you have a preference versus on the IPO model or the acquisition model? Do you think one serves the nation better than the other? What are your thoughts on that?
I think that depends on a number of things that are not under our control. And, ultimately, at the end of the day, what we want to do in this field is bring access to more patients. And like the route that you get there is not very important. And, it may be dictated by external factors that, you cannot do anything about, right?
Well, and we all lived through the pandemic and things changed, I feel like, so much in that, especially public perception. Where do you feel like, there's science and then there's public perception of that science? Where do those two things blend? And how do you kind of control that narrative? Or how should we be thinking about controlling that narrative?
Yeah, I mean, I think that you cannot control the world. You can only control what you say, right? So what we need to be doing is trying to communicate science in a way that everyone understand. So bring it up a level. I think scientists really struggle with this. Like you get very excited about a particular
True.
topic and you kind of dive into the details and most times you lose people and you don't realize that until an hour later. So I think we need to be better at like bringing things up, right? And and communicating what we think. I feel like when it comes to health, yeah, again, like many things happen that are external to our control. But at the end of the day, unless we find, the source of immortality, we're always going to come back to be interested in health, at some point in our lives. So
Yeah.
that's why I'm kind of excited and committed to the field. And I think people will see it. Maybe they don't see it today, maybe they don't see it tomorrow, but I think people will see it at some point.
Well, you absolutely are excited about it. I mean, it just radiates, your excitement for the industry and for everything that you're doing. I would love to ask you, because you are, scientist, and now you are in a role where you communicate a lot. You're pitching and you're talking and you're, explaining. What does that look like? Has it been a transformation? Have you always been really wonderful at communicating?
Oh no, this has been a learning experience. I've been listening to a lot of podcasts. I loved The Hidden Brain, and I loved Matt Abrahams from Stanford, Think
Yes.
Fast, Talk Smarter. And I actually met him recently, and I was so excited to
No
meet
way.
him.
That's amazing. I think I would have
Yeah,
probably
yeah.
fangirled a little
So
bit.
yeah, so it's been a learning journey. English is not my first language. So actually, I do rely on AI to sort of like sanity check what I write and what I put out there. So that has made my life easier. Yeah, I mean, I'm going back to writing. When I was in academia, obviously you're publishing and you're pushing things out all the time. But like that's something that I didn't do when I was in industry, and like now I'm again like keeping a blog and like that.
Yes, I read it. It's on Substack, right? Everybody should go check it
Yeah,
out.
it's on
It's amazing.
Substack. Yeah,
Yes.
yeah. And it's been fun. I try to keep it non-technical, so for anyone to understand. So that's been a lot of fun to kind of talk about, why I'm interested in this space, and talk about the science and where I see the opportunities, and who are the companies that I'm keeping an eye on.
Yes. Do you have like your top three companies that you're keeping an eye on, just to share, like a teaser for your blogs?
I'll encourage you to go there and
Go to
read
the
it.
blogs. I love it. That's good. Go read it, everybody. So we always keep these really short and sweet, but I wanted to ask you, is there anything we haven't covered today that you would want to share with our audience, knowing that it's a group of founders and funders both?
Um, well, I'm really happy that you have me do this. This has been fantastic. Thank you so much. Please
Yes.
reach out, and, I love to talk to people and learn about what they're interested in. And if I can help you in any way, I will try to do that. So please reach out and connect. I love to talk about cell and gene therapies and, difference of opinions. I don't shy away from that. So feel free to chime in and tell me what you think. And I think that's it.
That's amazing. Well, I always ask, what are you currently reading?
Oh, well, it's a little spicy. So I'm in a book
That's the
club,
best
okay?
answer I've ever gotten. I want to clip that out. Just that. It's a
No,
little spicy.
yeah, I'm in a book club, and we're all women, of a certain age. And yeah, the books that we picked for this
I
next
love it.
round, this next meeting, we're gonna need something stronger than wine.
That's amazing. I will link all the things in the description. If you want to find out about those companies she's watching and her spicy book recommendation, please reach out to Christina, because that's going to be fun. And I just appreciate you very much. Thank you for taking the time, for coming on the show, and for sharing all of your wonderful insights. Thank
Thank
you.
you so much, Molly.